Yes.
Hi, everyone. How are you? Good. People can hear me? Okay, great. Thanks for joining as always. Let's dive in here. Chief, you are not on mute. We have 775 cases and 19 fatalities in New Haven. As always, the 775 cases is probably a significant underrepresentation of the reality because we still don't have enough tests, and we suspect that there's a lot of other people that in the community that have it. Today, I am about to sign an order requiring employees of retail businesses to provide employees and require employees to wear masks. And I'm also requiring customers going into such establishments to wear masks. We've spent a lot of time doing outreach and encouraging people to wear masks. And while a lot of people are, what's important is that everyone does so, especially in environments where people are in close quarters. And the reason for that is to keep other people safe. Wearing a mask makes sure not that you don't get the virus, but that if you do have the virus, you will not spread it to others. And even if you're asymptomatic, it's possible that you do have the virus. So it's very important to wear masks. And I think we've gotten a number of complaints about people going into stores from employees that are at stores that don't feel safe. And this is a strong step in the right direction, particularly as we try to mitigate the spread. And in the long run, in the hope that we will open sooner than later, people getting accustomed to wearing masks is important. The masks that we're requiring people to wear are not medical grade masks. They're cloth masks or other fabric coverings such as scarves or bandanas. And it's important that people do not use medical grade masks or go out to try to purchase those, because those are masks that should be used by healthcare professionals. The stores that are covered under the order include grocery stores, big box stores, wholesale clubs that also sell food and beverages, restaurants and hotels where food is prepared, pharmacies, gas stations, convenience stores, liquor package stores. I've had conversations with some other mayors. I know that Mayor Kurt Lang will be issuing a similar order, and that some other mayors are reviewing this as well. I also think it's important to underscore that masks are easy to create, and they cost virtually no money because it's just a face covering over an individual's face. So it's a pretty low ask for individuals. And the order will, while I'm signing it today, the order will take or be enacted on Friday morning. I know that Director Bond has a couple updates about nursing homes and the numbers on funeral homes. So I'm going to hand it over to her now.
So good afternoon, everyone. And so in addition to ensuring that we are having this executive order in place, one of the things that we're continuously doing is monitoring our deaths and our case fatality rate. So of the numbers that the mayor just provided, our overall case fatality rate is at 2.5%. As indicated, 19 is the total, and of which 13 have been verified through our vital records department, which is our death certificate process. What I wanted to just add in regards to the death certificate process, excuse me, is that we, since the executive order went into place, we have 2 funeral homes that serve as our sub-registrars, where funeral homes can then register for the death burial permits. And so the process consists of us picking it up 3 days a week, our staff, and then ensuring that the death certificates are registered. And in that term, in that period, we then verify the death certificates that are being inputted into the surveillance system. Excuse me. And so that is the report for death certificates. Excuse me. We also have our facilities number that we've been monitoring. Our facilities numbers that we've been monitoring is the Grimes Center. We do have a higher number, as I indicated yesterday during our press conference, because we are monitoring not only the patients that are registered under New Haven, but there's also some staff that tested positive. So our number currently is at 68 for the Grimes Center. Also for Mary Wade, we have 19 inpatients, of which we are monitoring and working with the facility. And then the third facility that we're really trying to work with is Regal Care in New Haven, where they have currently reported 11 individuals. And so we're working in conjunction with the state just to do ongoing monitoring and assessment of their protocols to ensure that we can contain and mitigate the cases within these particular facilities. Again, we're also working with other facilities, but right now we're having ongoing conversations with these three. In addition with Bella Vista, each of them are being proactive, but we wanted to make sure that we were working with them once we know the numbers and are monitoring these specific facilities within the city of New Haven.
Dr. Bond, I hope you're doing okay. It sounds like
I
you got something to
know.
say.
I swallowed. It's not COVID-19. No, I'm just kidding. No.
Can you just clarify, so on the question about death certificates, that we are confident in the numbers that we are sharing and have had a conversation with at least one of the funeral homes to make sure that we're on the same page about those numbers?
Yeah, so it's really important. So, the question came up yesterday during the press conference and an article that interview in regards to the verification of death certificates within funeral homes. And so we want to make sure that as we agreed, we were going to do an assessment and really look at what that process is. And so what we want to just clarify is that there's the death certificates when they come in, the medical professional that indicates the cause of death indicates exactly what the cause of death is. So if they indicate COVID-19, that is what we go by. They may indicate that the person died of another underlying cause, but that cannot be changed from a medical professional. And then once that death certificate goes with the funeral homes, it then comes back. They file the permit. It comes back to Vital Records, where we then cross-reference it with our surveillance system. It's really important that we do that so that we can ensure the validity of the data that we're sharing. And so that's why when we are providing data daily during our press conferences, we like to indicate that our case fatality rate needs to be cross-referenced with our Vital Records death certificates.
Okay. I do not have anything else to add, unless anyone else from our team has anything to add. I'll open it up to questions. Let's go with Mary. Gage, it looks like I can't unmute people, so okay, great. Go ahead, Mary.
Maybe just a little something more on Grimes. They told me that the number of beds they have there is 70. So 68 is pretty much the entire facility, but just maybe you can just tell me how many staff members are part of that 68.
I will cross-reference the number of staff and the number of patients. I don't have that specific report in front of me at the moment, but it's a combination of the two, and some staff are not New Haven residents.
Some staff are not New Haven residents?
Correct. So they are not going to be captured in some of the numbers that we have for our surveillance system.
But you do two things. I mean, you're interested in New Haven residents, but you're also interested in the number of people that are sick with COVID at these facilities that you're monitoring.
Exactly.
So does it make any difference if a nurse is from Hamden?
Oh, no, absolutely, it does not. We are monitoring these facilities closely between staff and in the patients. But what I was referencing to is our surveillance system only captures New Haven data. So the number may not necessarily reflect the actual number of positive cases within a facility. Does that make sense? So
Uh,
so my facility right now, the mayor reported 49 to you,
right.
but that does not include additional staff members that are non-residents of New Haven. So technically, I want to verify the number. So if you take if you minus the 49 from the 68, that will give you a better count of who's staff and who's patients.
That data was old, right?
That data was also old, so I will certainly verify, Mary, who are staff versus patients.
That would be great. And then to have, I guess maybe I'm still a little confused about who gets into that number, but at the facility, I mean, I'd just be interested, whether they're staff, whether they're patients, how many there, and then if there's a split out from, the New Haven people, that the surveillance is contact tracing. Is that the surveillance system?
No, so the Connecticut surveillance system is where the positive cases come in, and they come in based on your jurisdiction. So my jurisdiction is New Haven. So if someone tests positive, works in New Haven, but resides somewhere else, I'm not going to have access to that data.
Okay.
So I work with the facilities to inform me of the total cases within each facility.
Okay, whether or not
They are a resident or not, correct?
not resident, because that's the information. And I don't, well, 49 was a really high percentage of the 70 beds that the hospital said was at Grimes. That was already high.
Mhm.
It's a lot of staff, if that's
Well, that's a combination of staff and inpatients.
the 49?
Yes, because some are New Haven residents, not all.
Okay.
So
All
I'll verify that number for you and get it to you so that you can have an accurate number.
right. Okay.
Nevertheless, Mary, that's a very high number. You're right.
Yes, very high.
Extremely
And
high number.
yes, and very much to be concerned about. And they've been very proactive in providing us updates, on an ongoing basis regarding the protocols and measures that they have taken to try to mitigate virus within their facility.
Right. I mean, I guess I've asked this before too, but uh, the state monitoring, other people monitoring, it is a huge amount, and that facility is connected to Yale New Haven Health. It just seems totally out of whack. That's not a medical term, but it really seems.
I think one of the things that it underscores is that the spread of the virus isn't necessarily an indicator that a nursing home or long-term care facility is run well or not well. It's that many nursing homes around the nation are really struggling with this issue. And we don't fully understand, for example, how the virus spreads. I read a study about how the bottom of medical workers' shoes have the virus on it. And so I think that, the fact that there are so many people at this facility that's run by or that's affiliated with Yale New Haven Health has so many cases is an indication that many entities are struggling with it. And it's not necessarily that one is run better than the other, if that's what you're getting at with the comments about it being run by Yale New Haven Health.
Right. The very first time this was brought up in a press conference, Director Bond talked about the kind of things they recommended to people. I mean, it seemed kind of obvious about testing staff as they came in, making sure that they had protective clothing. I mean, it seems so basic to actually kind of like.
Well, they're
tell
not
them
testing staff when they come in, they're screening staff when they come in. And some people are asymptomatic, and so they may not really realize that you know, they're have been exposed and have the virus. And so there's a lot of variables that we have to consider. And then earlier on, there's just different components happening in dynamics. And so, our job in conjunction with the Department of Public Health is really to try to determine the source of the problem, come up with solutions, and then just ensure that we're containing it as much as possible. And so, we're trying to work, with these facilities I wanted to also add to your point, Mary, about numbers. And I know you've asked repeatedly in the past, so you may be happy to hear that Department of Public Health is issuing a report later on today, and then they will do so every Thursday on 19 facilities in total for the state. So you'll be able to get some data as well that way.
Right, that's the list where they report that any facility has just one person that has COVID. Is that list or is it different?
It's going to be a new published list that is going to include 19 facilities across the state.
Okay, I'll just ask one more, then I'll come back later. Do you know how many of those people have gone to the hospital for either of those facilities? Or Regal, I guess, maybe too.
I can get those numbers. I didn't separate how many are currently housed in the hospital. Mary Wade had the majority of their patients in the hospital, and so I will verify those numbers and provide you an update.
Okay, or how many people died, I guess, maybe because of COVID there. I don't know if you know that for those three.
Okay.
Thank you.
Okay, I'm going to go with, I see Michael Bingham, who doesn't often ask questions, so I'll go with him first, and then I'll go to some other folks.
Thank you. Good afternoon. With regard to the new rule on face masks in retail establishments, you said that takes effect this Friday, 17th?
Correct.
How will that be enforced? Will the city do spot inspections or just respond to complaints?
Similar to the enforcement that we've been doing with a lot of the other orders that I've issued and the governor's issued, we'll be responding to complaints when they arise and sending someone out to just have a discussion with the business owner about how to manage the situation. We don't want this to be something where we're penalizing people, and by and large, we've found that with the other orders, people have been very cooperative. And they just need a reminder or someone from the city reaching out and saying, hey, this is really important for you to do, and we're keeping an eye on these things.
So the enforcement mechanism would be to tell them that this is a rule and to remind them that they need to comply.
Correct.
And not necessarily give out tickets or something like that.
At this point, no. Like every other order, if things became a major problem, I think we would reconsider, but at this point, no.
I see. Thank you.
You're welcome. Can we go with Kyle and then Shana?
Hi, guys. I have two sort of follow-up questions to the ones that were just asked. We'll go with the masks first. Are you going to also enforce that for customers? I understand the answer just now about the retail establishments. How would you go about enforcing it with the public?
I think it's the same thing. So ultimately, the business owner or manager has a lot of influence over this because they can refuse people that don't have masks. And so we would ask the business owner or manager to remind customers that they should be wearing masks when they go into stores. And just to give some examples, I've heard from a number of people who are trying their best to do the right thing and wearing a mask, again, not to protect themselves, but to protect other people. And they'll go into a store and there's a lot of other people that are coming closer to them that don't have masks. That's really unfair to the individuals that are really trying their best to protect the public. And they're not in a position as an individual necessarily to, in a position of authority to encourage other people to wear masks, but a business owner is more in that position and can play a role in encouraging and pushing customers to wear masks.
Okay, great. And then with the nursing homes, I know that we just talked a lot about that, and I'm interested in that as well. With the Grimes Center, I know we talked about staff being included in that number. Are staff included in Mary Wade or Regal Care in those numbers?
It's a combination as well. And so there may be slightly higher numbers. There are some right now that are being assessed to get tested. And so I will distinguish the number between staff and inpatients and then hospitalizations and death. So I'll get a full report for the next press conference.
Okay, thank you.
Thanks.
And my last question is for the police department. I was just wondering if there was an update there on the number of officers.
Yes, we have 6 officers that were impacted by COVID directly that tested positive. One of those officers has returned to work. 5 remain out, but I'm happy to report that they are on the mend and doing well. And currently we have 18 officers that are out for precautionary reasons. They may have had some sort of exposure and are in the status of quarantine right now, but we're doing well overall.
Okay, thank you.
Shayna.
All right, thank you for taking my questions. Just wanted to follow up with Mayor Elicker and also Director Bond, if possible, regarding the masks and the order. I know you work hand in hand with each other pretty diligently on these kinds of decisions. Can you just kind of talk to me from both of you about the partnership, and also if you can talk about if there are any ways that if there are any plans rather in place to help low income or other people that maybe don't have the ability or can't afford to get a mask? Is there anything in place on that?
Yeah, I ask you to clarify your question about the partnership, but I'll respond to the second question. That I had a handkerchief and folded a handkerchief up and used 2 hair bands to make a mask. There's a lot of tutorials online. If people can use a small towel, it costs no money. And we don't want people to purchase masks. In particular, we don't want people to purchase masks that the first responders desperately need right now because of a shortage of N95 and medical grade masks. And so this is not a hardship. When we use the term mask, it is very loosely defined as a piece of cloth that covers your nose and mouth, and that prevents your germs when you breathe or when you cough from going into the air around you.
Sure.
Can you explain your question about partnership?
Sure. Yeah, just can you kind of just talk to me about, I guess, the partnership that went into this decision? Was it a decision strictly from the city, or like how did this decision come down to create this executive order for this week?
So this started in conversations that we had after the CDC came out with a recommendation that the public should be wearing masks. And there's a number of other communities around the nation that have also implemented orders to require people to wear masks. Los Angeles is one. I understand the state of New York, Governor Cuomo just initiated a similar order. This is something important for people to get used to as well, because this will provide us more tools as we get into the habit of wearing masks in public places to protect other people from spreading the virus, and is a tool that we can use over the long run to help mitigate the potential long-term impacts of the virus. And when we do down the road start to open up, this is a way that we can reduce the spread.
Mm-hmm. And
Director
so,
Bond, yeah.
Yeah, I just want to add to that. So, as a health official for the city, we collaborate in every effort around ensuring that we are not only just bringing awareness about the facts about coronavirus, but also protecting our residents and really looking at this from a population health perspective. And so when we're trying to ensure that we're protecting everyone, we've been receiving a number of complaints in addition to the universal precautions that came out from CDC, where people feel unsafe when they see someone without a mask. And so in order for us to, when we're talking about messaging and we're talking about safety, is also the social responsibility for each of us to heed to a lot of the recommendations that were given so that we can stop the spread. And this is a mechanism to really just provide a proactive approach for everyone to feel safe when they're in close proximity to others.
And you've mentioned messaging and communication. Have you been in contact with, I guess, the immigrant community, those that maybe don't speak Spanish, to kind of get this message across as well, given the fact that this order goes into effect pretty soon?
Once the order goes into effect, of course, we are always seeking opportunities to message to all communities and from every single background. We utilize traditional media and social media and in conjunction with doing PSA and robocalls. So we will try every effort to ensure that our community leaders and messengers are also spreading the new any updates that we have as well. So it's important that we're doing it top down, bottom up, so that everyone across every sector is getting the information.
Thank you.
You're welcome.
So I just was notified that Bridgeport is also going to do a mask order. I see Tom raised his hand twice. I lowered your hand because I was trying to signal to you that I was going to get to you, Tom.
I thought maybe my hand had expired. So thank you for thank you for explaining that.
Sure.
Thank you for taking my question.
Of course.
Mayor, did you say that this executive order will require employers to provide cloth masks for employees at these covered outlets?
Correct. And so employees can opt to use their own masks, but it requires employers to provide masks to people.
And does this order that's coming out on Friday extend to people just walking around outside for physical exercise, or is it limited to people inside these retail and other outlets?
Limited to inside. We do encourage people that are walking outside to wear masks as well. It's much more important for people that are in close quarters with other people to wear masks, and that's why we felt like it was particularly important to require it in retail stores.
When you said that the city would send someone from, to check in and remind employers and employees and customers to wear masks, do you know if that would be a police officer doing that duty, a health department official, or have you decided yet?
I think it depends on the circumstance.
And Director Bond, I apologize that I did not quite understand the first time around, but could you explain one more time why your department is confident in the fatality number that you reported today?
Sure, we can talk about it again, because I know I had my little episode. I've been in meetings all day talking, so I had to take a sip of water. So what we do with our case fatality, as you know, we reported 19. However, 13 of those have been verified with the death certificates. The process with death certificates gives us more validity, because those are the death certificates that have noted COVID-19 as the medical cause of death. In addition, they went through the process of getting a death burial permit that ultimately it turns into a death certificate. And so once we have those verified, we can then confidently say 13 are verified within the parameters that I just described that Vital Records goes through with that process.
And you mentioned 2 funeral homes that the city has designated as partners in making sure that you have accurate data. Could you explain a bit more about what that partnership is and which funeral homes?
Yeah, so the process, so as you know, the executive order, once it was established, our Vital Records was closed to the public, the city closed to the public, and then we wanted to have a mechanism so that we can still have a streamline and eliminate any lag time of funeral directors having access to getting these permits. So we have 2 funeral homes that are serving as sub-registrars, which means that people can go there, funeral directors can go there, pay, and apply for their burial permits. In those 2 entities, I will disclose at a later date. I just want to make sure that we verify that it's okay with those 2 entities to share their information. However, what we can describe is that we go 3 days a week to pick up those applications and then finish the process internally within our office. And so that there is no disruption, at least with the funeral directors having access to being able to apply for those permits.
Respectfully, if you have already picked them, and I assume you've told other funeral homes that they can go there to use them as the service, I think you probably could share, but I also respect that.
I just want to be respectful before I start disclosing people without giving them heads up.
Okay, and then my last question is for Chief Reyes, and this may not be a COVID-related question, but unfortunately, I see that Captain Duff just sent out an email a few minutes ago about a 31-year-old man who died last night at the lockup at 1 Union Avenue. Do you have any details on this besides what was included in the press release? And do you know if is COVID a concern here, or is that not a concern?
So there is no indication that COVID is a concern. There will be a post-mortem examination done on this individual to determine what the cause of death was. And he was, as we stated in the press release, found unresponsive in his cell. We do not want to give any more details out. We're conducting an investigation, and as soon as we know what the cause of death is, we will put that out. We are also, by virtue of the fact that he died while in our facility, actually, he passed away. He was pronounced at the hospital, but we deem it as obviously an incident that occurred in our facility. We're conducting an internal review of the incident as well.
And can you say how many other people were detained in lockup last night?
I don't have that exact number. I can tell you that we've been trending somewhere between 3 and 4 people per day over the past 4 to 5 weeks since the start of the pandemic. And that's pretty much, I mean, that's a very low number compared to approximately 14 to 15 people per day during normal course of business.
Thank you very much, Chief, and thank you, Mayor and Director Bond.
Chief, I understand that there's an ongoing investigation. There's been so much conversation about COVID is spreading in prisons. And is it fair to say that the assessment is the cause of death is not or is suspected to not be related to COVID?
That is correct. We do not suspect that COVID has anything to do with it. I just don't want to comment definitively one way or another until the post, so on whether or not it was medical or otherwise. But we have no reason to believe it was COVID, sir. That's correct.
Okay, I think that's just important for the press to note, because there's been a lot of conversations about COVID being in prisons. And it's important to underscore that there's no indication that that is the cause of death in this circumstance.
Sure.
And I'm a little bit reluctant to push the deaths data conversation more, because frankly, I think it's confusing how the data, how we accept the data, and but I don't think that there are necessarily inaccuracies from any party that is sharing information. I think there's probably a question of timeline, and there also may be a question of cause of death and how we interpret cause of death. Mm-hmm. And that may be part of the discrepancy between the several funeral homes that were noted in the New Haven Independent article's numbers and the city's numbers. But we are all working hard to get a full and accurate and timely assessment of the situation. So I just wanted to underscore that, because I think sometimes in talking about these numbers, it can be pretty confusing, and we're all trying to get the right answer here. Are there other questions? Go ahead, Mary. Trying to unmute you here. There you go.
So I was just wondering if the city's ready. I guess the Abbott facility will be opening on Friday. I mean, there's work going on there, so ready for the, I assume it'll just be an enormous amount of traffic, but.
I know that Rick Fontana, our emergency operations manager, has been working every day with the state to coordinate that effort. And I believe we'll be releasing, Gage, is it tomorrow, more details on the site?
Tomorrow, Friday.
Okay.
I mean, I was going to double check with the state, but Friday was the day it was supposed to be opening. I don't know if you've heard anything different.
That's what we have heard as well. In which case, I would presume we would release things tomorrow and not Friday.
All right. Again, on the deaths, Joe, I just got them correct. The 19, the 13 is the longer verification that the city does, but you don't have any doubt that the 19 fatalities is the correct number. Is that right? Am I
Director
getting?
Bond.
Just trying to unmute my line here. So our case fatality reports come in through our surveillance system. And so we like to verify and cross-reference those numbers. So as of right now, 19 are showing in our system.
Okay. Anything more on the racial breakdown?
In regards to the fatalities,
Yes.
they were similar to the report that the mayor issued yesterday with the
No, I
graph.
guess it wasn't the fatalities. That's
Did you share the fatalities yesterday, Mayor? You
Yes.
did.
all right. But it's a more complicated one on people who are actually getting who've been found positive. That's where the biggest discrepancy is on race. So
Well,
nothing's
so
updated
that's where
on that.
so I can give you the fatalities breakdown today is 10 African Americans, 6 white, 3 Hispanic or Latinx. But the discrepancy, or maybe the discrepancy is not the right word. There's just a large percentage of unknowns when it comes to race and ethnicity for individuals that have been tested and tested positive. We do not know data on overall individuals that have been tested and have tested negative. We do not have that information. But of the individuals that have tested positive, there's a large percentage that are marked as unknown. So it's
Right.
difficult for us to get a entire complete picture of what's going on. Nevertheless, there's significant indicators that more individuals in the Black community are impacted by COVID-19, particularly when you look at the percentage of individuals that have been hospitalized.
Right. Okay. And any more people at Bella Vista that are sick with COVID? Is that?
We're
we
still
did-
we're
Go ahead,
still
sorry.
closely monitoring Bella Vista. And so the numbers have been steady, similar to what was reported in the past. There hasn't been any significant changes.
Okay, I didn't know if there was anything else to report on people going to UNH, going to other facilities, going to Yale, quarantined.
Chief, do you have any more people at UNH?
So I'll speak for public safety. We have the police has 3 of our officers at UNH being quarantined. Actually, they're there not being quarantined. They're utilizing the facility just out of precaution. And I believe that the fire department, the most recent number is 21.
Thank you.
Any other questions? Other questions? Okay, thanks everyone. I appreciate your time. Take care.